What's up, everybody? This is your girl Ericka from the Classic Clown blog. Coming in here late, coming in here semi live. I forgot tonight was a football night. This one's not going to be that long. I just want to start addressing the elephant in the room that we have a massive, massive blue collar shortage. What does that mean? That we have this massive blue collar shortage. What ends up happening is we need plumbers, we need welders, we need medical staff, we need all these things, right? Now, many of you don't understand. Back in the 60s or 1957-ish, they said, oh, we don't need that many doctors. At this rate, if we keep making all these doctors, we'll be like these, uh basically making fun of the islands. Islands have a bunch of doctors, that aren't actively practicing, right? Well, that was a problem because now for every one doctor coming into the health medical field, two are retiring, right? And the rest are up at the debt in their eyeballs. Now, same things happen in nursing. No one wants to leave to become teach nursing to young women. They'll give you all their various reasons why, but let's just go there. If I'm a nurse, I've been working for 30 years. I'm tired, my knees tired, my back tired. I'm a little burnt out. But I'm making 92 to 110, depending on the city, 130K a year, and yet you at the school, all you can offer me is 45, 65, 75. I'm sorry. There's not many people in an economic position who could take a half cut in their salary, who could go leave their current life and go teach. That's just, you know what I mean? And sometimes it ain't in you, okay? So, what has been our country's solution to this? Many of you talk about it, but in California, they import a huge number of Latino nurses, Filipino nurses. This is why it's always a running joke about Filipinos becoming nurses in their country because they knew, hey, man, I can always get a ticket to America if I'm in the medical field. One of the things people also notice, if military personnel, right? They needed dentists, doctors, nurses, etc., etc. Okay, there is a nurse shortage. There actually is a nurse shortage. There's a backlog at pretty much every single school in the whole nation. But I'll finish it. Okay, because that's a business structure that I'm getting to. Peppermint tea. I'm going to get to it. It's a structure, profit and loss structure problem. So now we're flooding hospitals with travel nurses. Okay, we're flooding the hospitals with um, foreign nurses, right? Okay, you're overwhelming the staff you already have. Now, then on top of this mess, you add the pandemic, the pandemic, the pandemic, right? And guess what happened? You threaten those same nurses that you already overworking to get out of here. Scram if you don't follow the rules, right? Now there's a lawsuit. New York, I think they had to pay over $10 million to, I can't remember how many people were in the massive class action lawsuit, but they had to cough up $10 million. Now you got 7,000 nurses. They done told you what time it is. Bring some monies. They like, okay, hey, calm down. What about a 19% compound pay raise increase? See, it's not just about the money, it's also their issues with how the structures run. Now, here's something that you guys heard all the time during the pandemic. Oh my God, the hospitals are overran. The hospitals are overran. The beds are full. The beds are full. Well, let me tell you something. If you know anybody who works in nursing, medical, information, informatics, nursing, informatics, any of that, the average hospital is always 85% full. That is the profit range. That's why they build them in the hood where y'all shooting them up. That's why they build them in certain areas. Not only can they teach doctors and incoming doctors on the fly in Chicago, they are making sure those hospitals stay full. Okay, so again, thank you, Canadian nurses. Everybody keeps traveling in. So now you got these internet nurses, these young chicks who only been working 2-3 years, okay, and they on the gram talking about their travel nurse. They're out here blowing up in your face how much they get paid. I even found out a CNA. I hate to say it, like wipe your booty level nurse, whatever. I'm not trying to be disrespectful, but they're so short CNAs. And what's the other one? Oh God, I just forgot the article. Long story short, they even get paid as travel CNAs. So there's a black guy and a black girl. They're like friends, and the guy's a little saucy, a little zest, and they have a huge Instagram, TikTok, and they're like, "Oh, we're traveling CNAs," and people laughed because they're, "Oh, y'all ain't nurses." Oh, but we get paid like nurses, right? And so they're showing off that even that's not a full nurse, that ain't fully went through the same year of schools, BSN, all that stuff, they make a lot of money, right? So CNAs be making money, even traveling. So now you're saying, Ericka, what's going to happen, right? We already know what's going to happen. We have a significant amount of baby boomers, Gen X, that's 43 to 57 at this point in their age range. They not staying at these jobs forever. They're not going to be their parents who are the baby boomers who are still at work. They're not going to do it. They're going to leave. They're going to vamoose. Okay. So now the techniques that were working before the pandemic was just import nurses. No problem. Just keep importing nurses. Second issue, let's just pay some travel nurses. That don't work. You have 7,000 nurses at one time saying, nah, we gonna lock it out. And you may say, well, that doesn't matter, but it does. They had to literally move babies from one hospital to another in New York. You know what I mean? They had to literally NICU babies, small baby, like that costs money to move children. I don't know who's getting billed, or is the hospital paying this bill? Because that's unfair to charge these parents medical transportation cost. So I don't know who is paying this medical transport bill, but I just want to tell you that what you're going to continue to see for the next 2 to 5 years, and I keep trying to explain to you, y'all think, oh, everybody's doing Instagram, everybody's out here trying to be a TikToker, everybody's trying to do, everything has its waves and cycles, just like you just had a wave of people, right? Just like you had a wave of people who were all on the gram, course sellers, truck owners, box truck owners, all this stuff. You're gonna have a wave of people do what? Go back towards what? Either driving the truck, either doing the repair, either owning the facility that does this stuff. But I'm being very clear. We're going to go to a boot camp model, right? Because the pipeline, as we would call it, like they're going to college, they're waiting. Even when I was in school, early 2000s, okay? Yeah, you girl old. Early 2000s, they had a issue with 122 nurses was what the East Carolina program could take every year. They reserved 22 slots for minorities in calls of affirmative action. So they literally had three, at one point, it was so crazy. They had to sue, do a class action lawsuit. They had 300 Black girls and Latino girls waiting for 22 slots. And the school said they couldn't fill the other 100. What was the other 100? White. It literally took the school going, oh, wow, we only have 80 white girls to fill this slot this year, to backfill the other slots and give them to all students. Now they say, oh, it's fair. It's just by your grades. If it's just by your grades, it's the top 122 grades, period. White, Black, Asian, whoever. The top 122 that are ready to go. Not this silly mess where they're reserving 22 slots. This has been a big issue for years. This is not going anywhere. So the traditional methods of you going to school and you love your school and you just, I'm going to wait to be in the nursing program. I remember meeting Black girls who were on their third year of waiting to be in the nursing program. And I would just be like, why don't you go somewhere else? Oh, I really want to go here and I part-time do this. No, girl, go. Leave here. Go to whatever school will take you. Bump with Greenville, but Greenville was so cheap, y'all. You could have a 2-bedroom apartment for $450. It was crazy. It was old, but it was ECU was a vibe. It was fun. So I'm showing you because my way my mind works, y'all. In my mind, I'm like, okay, 7,000 nurses. I know we called up. They probably been ringing the phone of every travel nurse in America and beyond. But in my head, I'm like, how much is it to put on a boot camp? How long is a boot camp? How fast can we twerk some nurses up into there? What we got to do, who we got to call? That's my first mind. Like, what do we got to do to rev up the nurse production pipeline, right? Because I know they're doing this in every other category. If you think about it, they're doing boot camps for tech. They're doing boot camps for pretty much everything. Radiology, boot camps for nurse informatics, right? They're doing boot camps for plumbers. Right now in Texas, the state of Texas is growing so fast. If you spend over 1,000 working hours underneath another plumber, you can call yourself a plumber. Straight up, you can call yourself a plumber, right? If you spend, hold on a second, y'all. If you spend X amount of hours, among a lot of places, you can call yourself officially A, B, and C, right? And that's becoming a issue because so many baby boomers, I'm telling y'all, every time I go down the road, I'm seeing on construction sites dudes who literally have like grays of hair, body looking like they about to fall down the pipe drain. I'm like, this guy's your construction guy? What he gonna do? What he gonna do? If one fall down, they both gonna fall down. So I've seen some really old construction site workers, and I already know what's about to happen. It's about to be boot camp crazy out here. Nothing wrong with that. Let me go ahead and pull up some of the boot camps I saw while I was over here studying. Okay, let me pull it up because, and again, there's a wave coming. Right, you're a nurse. You know they got all these IV drip places. You know you can work from home and look on the telehealth video. Right, I remember meeting a guy at the Grant Cardone Ventures event. He had built a telehealth company, but the problem was they could not find enough doctors and nurses to fulfill the jobs. So he had this, $1 billion company ideal and was going to do all this stuff. Couldn't fulfill the jobs. Okay. So first things first, here's Concordia. It's out of Texas. You already knew Texas was going to be in here. Do you want to become a nurse in as little, earn your BSN in as little as 16 months? It's called the Texas Accelerated Bachelor of Science of Nursing. If you got minimum 60 college credits and want to transition to nursing, come on in here, baby. We're going to knock you out the door in 16 months. And I said, okay, 16 months. That's not terrible. Then I went on here some more. I dug some more. Straight A nursing. Sound like something out of Compton, right? Straight A nursing. We're going to get you in here. We're going to get you in this boot camp. We offer 2 boot camps. You're going to watch these videos. You're going to get in here. You're going to skip ahead. Okay, this is for some classes. Let me go to the next one. NYC Skilled Nursing Boot Camp. Let me tell you something. Bring it in here, right? Coming in here is similar to Seniors Housing Boot Camp. They gonna do mock offers, test sheets. They gonna do all of it. You're gonna be in this nursing boot camp. They're about to hit you up over the head. Okay? All right? You doing crash course, basically. Let me go to the next one. Thinking of switching to nursing? Don't worry. We got you. Texas Lutheran University. We're going to have an accelerated program. 95% job placement in 6 months. 944 plus hours of hands-on-hand training. 90% packs the Nexus, NILEX RN pass rate. They about to get you in here. We about to accelerate you in here. We're going to get you in here 16 months. Get you out, right? Let's go to another one. Accelerated nursing of the incarnate world. 16 months, right? You're like, that's not bad. That's 16 months. This one says 1 year. We're done. 12 months. We're going to make you a nurse. Okay. 12 months. We're going to make you a nurse. Baylor University. That's why all them girls be in Waco. Just converting to nurses in a year. Okay. Clinical placement support. Not only are we going to make you a nurse in a year, we're going to find you a job somewhere. We're going to put you somewhere. Okay. Now, this program is designed for people who live where? In Texas and live outside the DFW area. We want to make you a nurse in a year. Get the support. Let's get you in there. Let me go. Where's the other one? University of Pennsylvania. They have an accelerated nursing program. Villanova University, Villanova. They have an accelerated nursing program. Who's the other one? Duke University now has an accelerated nursing program. And Northern University Boston, accelerated nursing programs. We got to get you in there. We got to get you out of there. We're done. Okay. Right. So what is the problem with the accelerated nursing boot camps? And I'm going to just tell you my thoughts real quick. Here's my problem. The girl or guy who's been studying for years, they're working on their craft. They want to be a nurse their whole life, is going to have a different, they're going to have a different mindset than someone who's like, I've got to get this in here in a year. Right? Because at the end of the day, I'm going to say this. The screens are changing. They should be changing. Because I kept changing the screens. Did screens work? Did y'all get to see all the schools I was picking? Did y'all see all the screens I picked? Put a yes or no. Let me know if you saw them. But look, here's the thing. This is what my mindset is. If I'm a girl, I took a bunch of classes in anatomy, I kind of know what I want to do. I kind of don't at the community college, but I got 60 credits. Baby, I just got to get into there, right? I just got to take the test. And in a year, I'm about to be a nurse. I'm gonna be a nurse, baby. I'm gonna be in there, baby. Right? So in my mind, this is not this is not the best way to solve it. Right? This isn't the best way to solve it, but I completely understand why these schools are like, look, let's get them in there, right? Because these girls have been waiting and waiting, right? Atlanta has nursing programs. The wait lists are years long. D Brown, that's my whole point. Leave Atlanta. These people are so committed. Like, doctor programs are the same. There'll be people who finish medical school and then they don't want to go. I don't want to be in Wisconsin. I don't want to be in Nebraska. I don't care where you got to go to finish that doctorate degree. Go do that. But I'm telling you, the girl that's like, oh, I got 60 credits. I took anatomy. I took some other stuff. Can I pass this test and get in here? Because even if you read the websites, two of them say is if you got a bachelor degree and it's not in nursing, you can come on in and be done in a year. I don't know about you, but some girl who was studying basket weaving and then decided to come in to be a nurse in a year, I'm a little nervous. I'm a little nervous. Okay. I'm sweating. I don't know why you want to switch up like that. So here's my issue with it. And it's the same as let's go there. It's the same as the ladies coming from Philippines. She didn't want to be a nurse, but she like, how can I get in America? I can be a nurse. They need nurses. Same thing with teachers. How can I get in America? I'll be a teacher. One of the issues I bring this up for is in North Carolina, the like many states, we have a program for teachers. If you could just teach for 3 years, your degree was paid off. Your degree was paid off. So you had all these girls like, oh my God, I'm gonna be a teacher. I'm so excited. I'm gonna be a teacher. They go be a teacher, hated it, not doing a great job, not liking them kids. Them kids is bad. And guess what? They just stuck it out for 3 years. They just stuck it out. Okay. That's all they had to do was stick it out for 3 years so they get their degree paid off and they rolled out. Same thing with police departments. Police departments have a lot of incentive programs. You can get a house, no heroes program, a lot of these programs. And guys, they'll notice guys will be a cop for enough, just long enough to get the hero program, just long enough to get some stuff and be gone. All right. Listen, basket weaving nurses taking 3 hours to get a vet. Listen, I was a military brat. We were at TRICARE. You know how TRICARE is, okay? So we're receiving care from people learning on the job. This man stuck my arm so bad, y'all, about 3-4 times. I started like to literally scream. And my mom was like, get this guy out of here. Finally, this girl came around the corner who was an actual nurse, not somebody in they scrubs, don't know what they doing. Actual nurse came and did it. And I'm like, ever since then, I've had a problem with people collecting my blood. I'll either faint or almost get faint. I'll be like, oh my God. It's just a panic mode because they're learning on the job. So that's why when people tell me, oh, I wish we had government health care like Canadians are coming across the border to get their health care. What are you talking about? Okay. For most stuff, they run across the border to get their health care. And they don't have good end of life plans. Diamond Dave did a whole show about how if you're poor, okay, and you don't have no money, Canada will let you unalive yourself. That's not good health care. But see, we don't talk about that part of Canada. We don't talk about, oh, Canada will let you unalive yourself. Okay. They come to Michigan. They come across the border to Detroit. They come make them hospitals great over there. Okay. So I'm just trying to get you to understand this is where this country is going. So when you have people paying for privatized, specialized, high quality care, you're going to start seeing that more. When I keep telling y'all, you're going to start seeing people have this kind of elitist healthcare. You're going to start seeing that more. The particular doctor I go to is $400 to even walk in that bad boy. And then they don't take any Medicaid. They don't take any Medicare. They don't take anything that's poverty related insurance. Like they let you know we don't take none of that broke insurance. Get out of here. Right. So the issue are you going to start seeing is, okay, the issue you're going to start seeing is this crash into the marketplace of people who are learning on the job, like the military. These crash of people who are like, man, I'm 29. I want to be a real estate agent, but I guess I'll be a nurse. You're going to start seeing some of that. And I feel bad for nurses because every time I ask my aunt, right? Okay. Every time I ask my aunt, who's been an emergency ER nurse, she's been a surgical nurse, she's been over a department before she hurt her ankles or her leg. She done did a bunch of stuff. And her biggest complaint is the new nurses coming in. She's like, I could not manage a floor ever again. These girls be on their phone. People be pushing the emergency call button, all kind of stuff. Okay. Right. You got people doing too much basically. Or she say they be chasing. Okay. They be chasing these doctors and the doctors be out here partying. Now I'm gonna tell y'all, when I was in Fayetteville, North Carolina, I had, I just had an emergency. So I go to the hospital. I'm there for 4 days. They can't figure out what's wrong with me. 2 African doctors are hollering at each other for who want to charge my really good, expensive health care to do these tests. Well, they had a young man, this is in July, young man who's a medical intern, what do you call him, learning to be a doctor. And he's like, oh, I think it's this. Now, if they'd have listened to him, these 2 African doctors, I'd have been good. Your girl would have been good. I'd have been good to go. But they didn't listen to him. So I ended up having to come back to Texas and go back to the hospital, not even a month later. Okay. So long the story short, all the nurses were from Ohio. People so broke, they trying to get out of Ohio because Ohio is in a depressed state, whether people want to be honest or not. Right? They leave in Ohio, come to North Carolina, South Carolina for nursing jobs. Okay. Then on top of that, I had African nurses who were rude. Literally, she's doing my intake form and she's saying, oh, your mother, I'm saying my mother's name, I'm drugged up. They're like, what's your father's name? I'm taking a second, because I'm sipping water and drugged up. And she's like, oh, do you know your father? Boy, I sat up so fast when that African lady, let me tell you something, bitch. My dad's name is da 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 da. And he died this day. She's like, I apologize. I'm looking dead at her too, like, you play that shit with some of these little poor broke kids, these Pookie and Ray Rays, but you don't play that shit with me. I'm gonna report your ass. My aunt said the other hospital, but I'm gonna report your ass. Okay. So you already got care. I'm gonna just say it. You got these care from these African doctors who don't care. All folks that skin folks ain't kin folks. Okay. You got these other doctors coming in. They don't care. Now you got these nurses coming from Ohio, 62 years old, just trying to keep nursing because she just had to get out of Ohio. Then you got the African nurse who's being disrespectful to you. I don't know what kind of care y'all think y'all about to get in these hospitals in the next couple of years, but it's about to be rough. I'm out here in Austin getting the best white American care I can get. I got a Jewish doctor, and even he has a bunch of young nurses that's on their phone typing when I'm at the office. I'm like, well, dang, girl, what if I fell off this bed? What if I fell down the hall? What you doing? Okay. I was at the office one time. All the girls are in there laughing, Jacqueline, kikiing and texting on their phone. This woman came in, older white lady, started wigging out. They don't have mask on. They're just in here and they don't have mask on. And I'm laughing, right? I'm like, chick, you need to calm down. Like, we back here, chill out. Like, we not in the front area. We get back here. And so the doctor come around, it's 3 of them. He's like, hey, you guys, put your mask on. Put your mask on, you guys. Okay, put your mask on. And so everybody in there putting their mask on, looking mad as hell at this lady. And I'm looking at them like, even in this location, wealthy neighborhood, in the Jewish neighborhood of the Austin area, best care I can pay for. They got girls in there kikiing, laughing, and ha ha ha. It's crazy. It's going to be a mess. So I'm telling you now, while the open enrollment insurance is till January 15th, I'm not just trying to take anything. I'm like, look, can y'all cut me a break on the price? But I need the best health care that I can have, because the way they acting at these hospitals and the way they short and the way any woman who don't have a lot of kids or she can move around, she going to be a travel nurse. She's not going to be some young nurse who's like, I just want to be the best nurse I can be right here in this town. She going to be like, guess what? I'm gone. I'm going to go back here. Somebody said all these old nurses can hardly walk. Let me tell you, my aunt had great knees till one day they had to pick up a 600-pound life patient. It's 3 nurses on one side, her on the other side with 2 other nurses, and they had 2 men nurses helping them. So it was like 4 women, 2 men. And all they was doing was a slide, okay? Between sliding that 600-pound life person, took out my aunt's knee and took out a male nurse's knee. Like, literally, they had to be helped to the ER because their knees went out that day on the 600-pound life person. So what ended up happening is they like, well, it was a safe slide. It was 6 of y'all. Y'all know damn well that man was 600 pounds and them people shouldn't have been sliding him in there. Okay. So at the end of the day, okay, nurses, good nurses. And my aunts moved around too for nursing. She went to Baltimore, she went to Maryland, she went to some other stuff because she was like, hey, why not? I can move around. At the end of the day, you're going to lose the good nurses. These older ladies are just staying for the paycheck, okay? They staying long enough to work and long enough for a paycheck. Every time I go back to Cape Fear Valley, when I'm in Fayetteville, there's a lady, I swear she's 92 years old. I don't know how she's still working, but she at a front desk typing, okay? That's right. Somebody said they making TikToks at work. You already know. Listen, Rebel Zoe, that's what my whole family said to her. She's like, why did y'all try to slide this man? You got to call somebody else because this you not young. You're not a young woman trying to slide somebody. You're not young. You seen her. Listen, if you've been to Fayetteville and you've been to Cape Valley, I'm telling you, that lady, 92 years old at Cape Valley. I don't know how she legally still there, but she there working. I've been a nurse for 24 years. One of your best bets is preventative care when possible, healthy food, movement, water, regular checkups. And this is part of why I'm telling y'all the whole move to cryotherapy and massages and HSA accounts and do you want red light therapy? Do you want what do you call acupuncture? All this stuff is going to blow up. The IV drip therapy, the oxygenated stuff, all that stuff that people think, oh, that's for people who have money. No, that's preventative care. Preventative care. So they had a combination. So down to earth, they had a. I'm not even being funny. They had a crane. That is why my aunt and the other male nurse who knee went out. They said that the combination of the crane and the nurses moving him, okay, was allowed them to one not sue the hospital for their knee injury. I know you're trying to be all smart. That's a crane service. I'm just telling you, this is a real life person in my family who couldn't sue and couldn't do anything but be removed off the shift because her and the male nurse knee went out. So again, you act like there's 52 cranes in the whole hospital and they're gonna have it there and they're gonna prevent. No, that doesn't always happen. Cut it out. Stop being a smart ass. Okay. Hey, no limit. Thank you for saying that. We will see him tomorrow. Good job. We'll see him tomorrow. Okay, thank you. Oh, he would have stayed there, baby, till they got there. All the therapies that allow you to do as little as actual work as possible will boom. Facts. Oh, you talking about construction crane? I thought you were being smart. I'm like, there ain't a crane. There ain't a crane that could move that man in that hospital room. That was manpower. That's what it was supposed to be, but it was a bunch of women and two male nurses couldn't do it. Okay. But yeah, that's why I said I totally want to own a cryotherapy related place where I have sauna, where I have red light therapy, where I have a plunge, all this stuff. Because I know what's gonna happen. All right. I just already know I see the writing on the wall. Where the stripper nurse administrator you the wrong medication. Listen, there's a young lady who's on Instagram and I want to invite her on the show. And she's a former stripper, now a tech degree. Now people say, well, them girls, once they get in the life, they never leave the life. That girl done changed her whole Instagram up. It was always pole dancing and cutting up. Now it's literally, y'all, look at me and my job. Tech, 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 tech. And some dude at that job gonna pick her up, y'all. Don't get it twisted. Some dude at that job gonna pick her up. Okay. That's all that is to it. That's the same thing that's gonna happen in nursing. That's the same thing that's gonna happen in the CNA areas. A lot of times I've always been kind of pushed back against CNAs. I feel like they always push that for black and brown girls. But if y'all can do some travel CNA, sis, pick it up. Oh my God, I had to send a 500-pound person to the zoo to get an MRI on her. I'm not surprised. Let me see. She probably will. IV therapy changed your life. Congratulations. Hire me, Ericka, bedside nursing. I'm in school now. Listen, I'm telling you, this is a big thing. You're going to see. Okay. Also stretch therapy. It's a place called Stretch Zone. You're going to start seeing a ton of these places. I went into one near Georgetown, Texas, where all the old white folks are in the old golfing area. You know what I'm saying? Old black people over there too, but mostly it's like retirees in this one area. They do these assisted stretches, y'all. I felt $1,000,000. You're going to start seeing more stuff like this, right? There you go, Marion. They deny your claims. I experienced the same with a 500-pound patient. Yeah, they literally told them they could just leave their shift and go downstairs. And my aunt did have to have a knee replacement. I think the younger guy, I don't know what ended up happening to him. I'll ask her on the update on the story, but I'm telling you, it's wild out here. I saw PTs and OTs as old as my mom still working 70 plus. Yeah. Oh my God, a lady was just telling me about the drip. She does it once a month, only like 150 visit. Yeah, the nurse that I had at the drip place was on camera and her dog was barking in the background. I saw her, she had the scrub tops on, but I knew she had on pants. I was like, oh, you're working from home today. And she just started laughing and said, I work from home every day. That nurse didn't even care, y'all. She's like, I work from home every day. And they have to. Every one of these IV drip places have to have a nurse. Thank you again. Thank you again. Okay. Young people running, my friend left was not lifting those people. We have a CNA who's 80. She will not retire. Other CNAs hid from her because she always needed help. And they will, guess what? The hospital ain't letting her go. That's ageism. Okay. The hospital can't let her go. That's ageism. 6 months on the floor, straight to MP school, Botox, spa, remote. Yeah. This is going to be a big trend, you guys. Okay. If you see this is the accelerated program. They can get you in there in a year. Baylor, we gonna get you in there in a year. This is who gonna be handling you. Okay. Their goal, again, this is the need. Can you guys see the screen? Okay, good. 1 million RNs will retire by 2030. Let me say that again. 1 million registered nurses will retire by 2030. Texas has become the second largest RN shortage in the nation. That's why you see women coming down here. They a nurse. Come on down, sis. Okay. Nursing roles are expected to grow 12% through 2028. Again, you have a catastrophe in America right now. We got food shortages, we got old farmers, the average farmer is 65 years old. We got nursing and healthcare issues. We have a aging population. 20% of all white people are 65 years old or older. Let me say that again. 20% of all white people are 65 years old or older. The average African American person is 33 years old. The average Hispanic American is 31 years old. So again, this guy did a whole talk about Las Vegas, how Las Vegas is the future of America, how like majority of the people working are young and brown and the people that are retired are older and white. It just will be what it'll be, right? So in my mind, what do we need to do? This says the demand for healthcare, especially climate in rural areas. How do we convince nurses to come to rural areas? How do we convince doctors to come to rural areas? Right? ECU made a whole rural medical program to incentivize y'all and PAs to go to rural areas. So you're going to start seeing these pop-up boot camps. They gonna get this done. There was a program in North Carolina, if I could go find it, where they would make HVAC repairmen in 6 months. I think it was like closer to 5 months, but they were like the fastest nation. It was in Greensboro, North Carolina. Everybody hired men all over the nation from Greensboro, North Carolina. People knew if I go over here and do this HVAC thing, I'm gonna get a job. It's going to be the same with nursing. You're going to see a lot of people just all of a sudden, yeah, I'm gonna be a nurse, girl. Well, that takes so long. No, girl, I'm in a year program. We were in San Antonio and our bartender was talking about he was tired because he's got nursing exams coming up. I'm like, the bartender? And he was a little quirky white dude. I was like, okay. I don't see you being a nurse, but hey, I get it. Okay. So again, these 7,000 nurses that are burnt out and exhausted, they just been able to collectively do something well in New York. A lot of this ain't going to go down. This ain't going to go down in a lot of places. After bargaining late into the night at Mount Sinai Hospital yesterday, no tentative agreements were reached. Today, more than 7,000 nurses at 2 hospitals are on strike for fair contracts that improve patient health. What they saying is, cut me some monies. Okay? These people say safe staffing saves lives. And I get it. You should have multiple nurses on the floor for sure. I'm not against that part. But it is a money thing. It is a profit center. Hospitals run off profit. That's why when we were the whole pandemic, they're like, the hospitals are full, the beds are full. Hospitals are 85% full at all times anyway. So you just have a spike one day, you got 85 beds and 15 more people come in. Oh my God. We're in a crisis, a medical crisis. No, you're not. They're a profit center. Okay. Now, again, it says the city, which is New York City, has 75,000 licensed registered nurses working at all manner of jobs. So finding replacements for 7,000 strikers will be a challenge. Okay. Since the hospitals have been preparing for a strike since Nurses Union gave a notice of the plans 10 days ago. Y'all, they knew they couldn't just strike the next day. You had babies, you had elderly, you had hospitals, you had surgery scheduled. You had to get all this stuff fixed. Okay. So the nurses didn't do it disrespectfully. Okay. I'll just say that part. The affected hospitals plan on paying temporary traveling nurses to fill in possible. Some have already begun transferring patients. Mount Sinai spokesperson said Monday it has brought in hundreds. Let me say that again, hundreds of traveling nurses, and some of the hospital's non-nursing staff have been redeployed. There are 3,600 nurses in the union of Mount Sinai. Okay. The overall effect of New York seems minor. Y'all, this ain't minor. This is a way to downplay this. Like, oh, it doesn't matter. The staff of nurses are assigned 12 patients when the maximum should be 4. It's not safe having 12 patients to one nurse. That's not possible. It's very unsafe. Okay. They even had to start transferring infants in the neonatal intensive care unit at the end of the past week. Hospitals are facing, yada, 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 yada. Okay. Again, the top concern is patient safety. Let me go down here. Now, eventually what they end up saying is they came and said, hey, what about 19% increase on pay? Right? What about that? And the nurses voted and it was 57 to 43. Right. And it was like, no, we got to come back with some more numbers. So again, a lot of them are saying it's burnout. They're tired, issues. Okay. But the largest 3-day strike by 15,000 members of the Minnesota Nursing Association involving 13 hospitals in the state. Okay. So it's not, it's a big one, but it's not the biggest. It's happened before. So what do hospitals think they're going to do? They're going to wait these ladies out. Why? Because most people money ain't right. Most people money ain't together. Okay. So I'm mad how they put their girl out as a spokesperson, but I respect it. She out here, she's a spokesperson. She got to do what she got to do. Okay. So let me see what y'all had in here a little bit more. I missed a few. Oh gosh, let me see what else. I mean, I'm glad you had great African doctors, but on routine, I've had terrible ones. Terrible. So they're thinking about putting a curve on the test. Listen, they're gonna do it. Trust me. Yeah, Canada will let you maid yourself if you're homeless. That's what Canada thinks is a great healthcare resolve. So, you know what I mean? Good luck if you're in Canada. Good luck. Yes, the exotic dancer to tech lady has a YouTube channel too. Don't worry, she's gonna be married at her job. She gonna live a good life. She gonna be just fine. Now content creator on YouTube was a stripper. Now she owns businesses. Okay, buildings. Sorry, they paying nurses 500 an hour to do meds. It's so short. I believe it. I'm about to reboot my health and fitness channel. AM1. This is the time. Stop playing AM1. January 1st to April 15th is when everybody's like, yes, I got to do my health. New year, new me, money, money, money. Let me take care of my health. Let me walk. Y'all, I've walked outside the past couple days. We did today and a couple days ago. And I'm telling you, there's a difference when you walk out in that fresh air, okay? And up and down some hills versus that treadmill, okay? But we've just got to get moving. This is just what America needs, honestly. Thank you, Nerds P, for the $4.99 super chat. Got my back adjusted. It was a game changer. Yeah. Somebody said travel nurses make stupid money. I recently heard a nurse made 6 digits in 2 months. Yeah, a lot of them are making great money and then take a month off. 2 months on, 2 months off. It's a lot of, I think the assignments are usually, the girl I talked to, her assignments are like 6 weeks or something to that effect. 6 to 8 weeks or something. One lady said they took her to Alaska. She couldn't take it. She couldn't do Alaska. She had to get out of there. Listen, the next 5 to 10 years will be a gold mine to take care of geriatrics. It really will. I'm a registered nurse and left bedside hospital almost 20 years ago. Been in tech ever since. Bedside can be emotionally and physically taxing. Yeah, you're seeing people. Unfortunately, there's a lady on TikTok right now that's viral. She's like 50 something year old lady. She talks about hospice care. Ooh, I watched some of her videos and I had to stop. She was just saying how people be reaching for their loved ones. They be, these movements they make. She's like, oh my God. So home care services, yeah. Get much education on trauma unit. A doctor or nurse gets paid more in a rural area where it costs less to live. They do, but you got to market to them to get there. Everybody, Hallmark, I believe, is in cahoots with the government to get more people to the rural areas. Hallmark, every movie's like, girl, move out here to the country. Get you a fine country man. You know what I mean? Because just like in the 90s, how they had all the women move to New York, move to New York, girl. Sex in the City, girl. Life in the big city. And now they like, girl, go to the country. Go on to the country. Okay. Only 30% of people who are getting MDs are actually practicing medicine. They're going to medical sales. This, Drew, I don't know if it's 30%. I know it's closer to 50 because the next problem they have when they do get their MD, because I have a friend who's got his doctorate, is people. So you do these rounds, right? You get to see what a surgeon does. You get to see what a family practice does. You get to see what ER, and then a couple other things, right? My friend said everybody, once they saw surgery, like, the dude that does breast jobs, augmentations, tummy tucks, they're like, why would I go work in family practice? So they're losing out on a lot of numbers of convincing guys and girls to go into family practice because why? When you can make money in surgery, you can make a ton of money in surgery. It's just, it's going to be hard either way. My sister just moved to the middle of nowhere, Texas. I'm sure she has at least 60 credits. Go tell her. I'm telling her she can be a nurse in Baylor. She want to move to Waco for a year or do it online. Can you imagine what you could make opening up a full saw, massage, drips, calling on? Yeah, it's a moneymaker. Harlem Hospital, the trauma hospital specializes in gunshots and stabbings. That's terrible. I'm doing an accelerated micro master's tech program. Getting certified is taking less and less time. Yeah. So this is the thing. Somebody was kind of throwing shade on tech people getting jobs. And yeah, you're going to get in there. You're going to make 80K a year, but that you're not going to make a ton. That's not true. What happens is once you get your foot in the door, see if that company will pay for your bachelor's degree. See if that company will pay for you to get more certifications or pay for you to get more training. Like, at the end of the day, that's what those companies are going to do. Yeah, that's probably that. Let me see. I just left NYP about 6 months ago. I have definitely been thinking about spa and doing drips. Yeah. My wife is a travel nurse and I work. Wife plans on taking a contract in Texas when my daughter gets out for the summer. We're going to use it as a change of scenery. Listen, Big Daddy Rocks, go ahead and get that big money. All bucks, no whammies. They've been offered 10K a week to cross the line. Good gracious. In California, the nurses patient 8-to-1 patient ratio for sure. Yeah. HVAC, plumbing, electrical apprenticeships or through community college, and NC is big. It's big because there's so much in North Carolina, South Carolina, and Georgia that will just consistently need construction and repair. It's very unsafe. Let me see what else y'all got in here real quick. Only go to hospital as a patient if you have no choice. I mean, listen, I'm. It's tough. You know what I mean? Like, it's tough because I really believe that the quality of healthcare is going to be great for a set number of people, but not for a lot of people. Oh, yeah. The shortage on respiratory therapists is bigger than nurses. I've heard that. I had one of our classy climbers. His wife was a nurse. He was a respiratory therapist, and they were doing the travel respiratory thing. And they could, after a while, COVID just took them. They just mentally needed to stop because they were like, it just was too depressing. But I understand it. So here's the thing. It's not just disposable income. It's if you feel like this is healthcare. For a while, I could not feel like it was health. Like I needed to be in cryotherapy. My lower back was just be screaming. I get cryo, back relax. I'm like, this is necessary, right? And it'd be so affordable. On top of that, you can use your HSA account to do all these things, to swipe for a lot of these services, massages, you name it. So you're going to be paying for healthcare either way. Figure out how to do it. Yes, she said 6, 8, and 12, 16, 13-week assignments. Massive shortage in law enforcement. Yeah, I mean, like it's a certain type of personality that you're picking up for law enforcement. Why do you think LA has been recruiting from Mississippi, Alabama, Georgia for years to bring them out there to LA to work LA? Nobody from LA wants to be a cop. I'm an MT and I see firsthand how nurses get burnt out. For sure, I believe it. I'm an OR nurse. Love it. Good. Cash up front. Yeah, you're going to have a lot of places working like that. We just don't know about them. Let me see. Doctors, medical, you play stupid games, win stupid prizes. Yeah. Respiratory, $80 an hour. Bo, that's ridiculous, but I get it. She said at the height of the vid, they were having traveling nurses making traveling respiratory therapists making $7,000 a week. I was making $9,000 weekly. Ooh, I could not. That's a lot, but I get it. So anyway, so this is just my 2 cents on this. I'm not gonna be here much longer. I'm gonna go eat my dinner. I just want y'all to understand that like a lot of positions are changing. So even when they talk about tech, oh, you're gonna get tech and make 80K and you're gonna be stuck there. No, you're not, because there's so few people who actually study, do the work, prepare, get ready. Same thing in nursing. You're gonna see a bunch of 80, 90-year-old nurses sitting at the counters. You're gonna see them everywhere now because they need the money too. The inflation's hitting them. So pay attention to the quality of care some of y'all might be getting in a couple years. It might be a little funny. You know what I'm saying? It might be a little weird. So that's what I got for y'all. Someone said I worked all through COVID. I took 4 months off. Please take it off. Go travel, reset yourself, because you're no good to the hospital or yourself that way. But I see this resolving itself. That yes, they gave them 19% compound increase pay raise. But New York was the same place where I think was it 32 nurses or was it 45? It was like 45 black nurses had to sue because all the black nurses were getting like 60, 70K a year. They were asking their coworkers how much they're paying. They're getting 90, 100K. And they end up suing. But my thing right there already is, look, baby, you in New York. You didn't negotiate your salary. Again, they know so many people don't negotiate their salary. They know women especially don't know. So you just tell them a number and see what they say. They'll take it. So they had a lot of these black nurses making 55, 65, 75, and their counterparts were making 100. That's on you, sis. You should be asking them, I need 20K more. I need 20K more. You know, ask for it. You never know. All they can say is no. But people be so pressed, ready to get these jobs. That's what ended up happening. So anyway, yeah. Engineer in tech, your first job, 80K a year. After a year of study, find a job for 150K. This is the stuff, engineer accountants. Nobody wants to hear this part, that they might have to pick a new job. They might have to keep studying. They might have to keep improving themselves. Some medical insurance policies will pay for a lot of these services. This is true. So look, you guys, this is your girl, Ericka Classy Climb. Thank you guys so much. For those who attended the credit training, it was a blast. Definitely put the recording up. It's in all courses right now. This 14th, January 14th, we'll have the digital real estate training for how to get 100K in your year for 2023. What are the steps you need to take? How do we get it done? Where are the partnerships you need to be making? Check out the show tomorrow. I think tomorrow's the 10th. We'll have Donald Span on how to set up a virtual call center, how to set up a virtual receptionist office, how to have hundreds of employees, all virtual. There will be plenty of ladies that won't be nurses, but they will try to figure out how to work from home. This is a great opportunity. So anyways, you guys, this is your girl, Ericka, Classy Climb Blog. Thank you so much for being here. There's 430 people that have been in and out the chat. If you guys hit the like button. All right. Thank you so much. There you go. They tell you not to talk about salary. There you go. Anyway, I'm going to go ahead and get on out of here.